Extract 1. Questions 1 to 12. You hear a physiotherapist talking to a patient called Ewan Hunt. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi there, Mr. Hunt. It's good to see you again. Just to reassure you that I've received your file from Dr. Patel and her letter as well, okay?
Thank you. It's really good to see you, too.
Oh, happy belated birthday for yesterday. Am I right in thinking you just celebrated your 60th?
Yes, thank you.
Did you do anything nice?
They made a huge fuss at the restaurant where I work. I kept telling them that I'm too old for all of that, but they weren't having it.
All right. What do you do?
I'm head chef of an Italian on Maple Street. We serve authentic cuisine. You should try it.
I might do just that. So, you've been referred to me to help you manage your condition, and it says here you've been experiencing quite a few symptoms, is that right?
That's right. I've got COPD, probably from all that lighting up I do all the time. I told Dr. Patel about the coughing already, but I suppose the main thing is that it happens a lot more now. Worse still, now I have phlegm too. It's quite disgusting, kind of yellow, green. You already know about the wheezing. That's probably the worst of the three.
Well, I don't want to sound like I'm preaching, but you do know what I'm going to say, don't you?
Course I do. I've heard it all before. You're going to ask me to give up the facts. But it's not that easy, you know? I've been doing it since I was 16.
Why did you start, if you don't mind me asking?
No, I don't mind. Couple of lads on the estate reckoned it was the coolest thing since the advent of the wheel. Once they were doing it, everyone followed suit, so I guess you could say that I was peer-pressured into it, like. Haven't looked back since, really.
I understand. It says here that you attended sessions at the clinic. Didn't they help?
It wasn't sessions. I actually went to a special smoking cessation clinic in Finland for a bit. Cost a pretty penny, too, but at the end of the day it didn't work.
Sorry to hear that. I'm trying to think of the best way to help you now. What's your day-to-day like?
Really, I'm mostly fine. I suppose that I do have one gripe. I get a bit breathless and I'm finding it hard to keep up my social life. I've always found the rush at work difficult, like when diners come in on the evenings and the weekend and everything in the kitchen is intense. But now, even when I'm lifting pans from one end of the kitchen to the other, it's tough. Also, I can't do the things I love anymore, like hiking. Used to go every weekend, but now I get breathless just thinking about it.
Mr. Patel has suggested I can prescribe you with an inhaler if you feel it would help. You can take it as and when you need.
That sounds good.
You'd need to take 1 to 2 puffs a day, as and when you feel the breathlessness coming along. You can't take any more than 4 puffs in any 24-hour period, okay?
Understood.
There's another thing I've been asked to talk to you about. There's a procedure that you could try called endobronchial valve insertion. You've been identified as a potential for it.
Endo what? I can't even say it. What's that?
It's a relatively risk-free procedure to insert a tiny valve into your lungs.
I think I'll pass on that one if you don't mind. You hear all kinds of horror stories of people dying on the OR table these days, especially now that our hospitals are so stretched for staff.
Not a problem. The other thing I suppose is just to echo Dr. Patel's advice about weight loss to you. Happy to show you a few exercises that I think you'll enjoy as much as you did your other activities. Then I guess we can pick up again in 2 weeks' time, see how you're...
Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Thomas Andrews. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Doctor.
Good morning. Have seated. May I know your problem?
Well, I'm a patient with hypertension, chronic intermittent bipedal edema, and recurrent leg venous ulcers. I had a vascular surgery for non-healing right ankle stasis ulcer. I have a serious concern today that I had a low-grade fever of 100.2 early this morning. Otherwise everything was well. The thing is, I was not even aware of the fever. I do have some ankle pain, worse on the right than the left.
Okay, what's your age?
52, Doctor.
Do you drink or smoke?
No, Doctor.
Are you getting nausea, vomiting or diarrhea?
No, Doctor.
May I know your previous illness history?
Well, hypertension, exploratory laparotomy in 2016 for abdominal obstruction, cholecystectomy in 2017, chronic intermittent bipedal edema, venous insufficiency, chronic recurrent stasis ulcers.
What medications are you taking?
Primaxine, daptomycin, clonidine, furosemide, potassium chloride, lisinopril, metoprolol, ranitidine, colace, amlodipine, zinc sulfate, Lortab, multivitamins with minerals.
Are you allergic to any medicine?
No, Doctor.
Well, the physical examination shows heart rate 73, respiratory rate 20, blood pressure 104/67, temperature 98.3, and oxygen saturation 92% on room air. There is hyperpigmentation involving distal calf on both legs. There is an open wound on the right medial malleolar area measuring 9 by 5 centimeters with minimal serous drainage. Periwound is hyperpigmentated with a hint of erythema extending proximally to the medial aspect, distal third of the right lower leg. There is warmth but minimal tenderness on palpation of this area. There is also a wound on the right lateral malleolar area measuring 4 by 3 centimeters. Another open wound on the left medial malleolar area measuring 7 by 4 centimeters. Wound edges are poorly defined. Laboratory results show white blood cell count is 5.8 with 64% neutrophils, H&H 11.3/33.8, and platelet count 176,000. BUN and creatine 9.2/0.52, albumin 3.6, AST 25, ALT 9, ALK-Phos 87, and total bilirubin 0.6. Chest X-ray shows chronic bibasilar subsegmental atelic stasis, likely related to elevated hemidiaphragm, secondary to chronic ileus. No absolute findings. You have multiple previous wound cultures positive for Pseudomonas, Enterococcus, and Stenotrophomonas. Fevers, right leg, ankle cellulitis, chronic recurrent bilateral ankle venous ulcers, hypertension. I am ordering 2 sets of blood cultures, injection with daptomycin and primaxin 4. I am ordering an MRI of the right ankle to check for underlying osteomyelitis. Follow-up results of wound cultures. Additional treatment and medications are upon follow-up.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25. You hear a nurse talking to a patient who's about to have a mammogram. Now read the question.
So, have you had a mammogram before?
No, I haven't, and I do have a few questions actually. Like, what about the radiation? Do I need to worry about the dose? Is it likely to be harmful in any way?
No, it's very low. In fact, it's similar to the amount you'd receive if you took a long-haul flight.
Oh, yes, that reminds me. When will I hear? 'Cause I'm away in New Zealand for a month from next Wednesday, and I'd like to know as soon as possible.
It'll take about 2 weeks, but if you're concerned, we can give you a number to call.
Oh, thanks. That'll be a real help, actually. Then, for me, the big question is it going to hurt? I've been hearing gruesome stories from friends, and my anxiety levels are going through the roof.
Okay, I understand. Perhaps you could tell me exactly what you've heard.
Question 26. You hear a doctor talking to a patient about a blood pressure monitor. Now read the question.
It's like a normal blood pressure monitor, but it's mobile. You wear it on a belt around your waist, and it's attached to a cuff on your arm. Then you just go about your usual day-to-day activities, and it takes your blood pressure at regular intervals. It's more accurate because we can avoid what's called white coat syndrome. It beeps first, usually every 30 minutes or so. When that happens, you should sit down if you can, hold your arms still, and keep the cuff level with your heart.
Do I have to wear it at night?
Yes, you do. You could put it under your pillow. It needs to stay on for 24 hours, though you don't have to wear the belt.
What about showering and stuff?
Well, I was about to say, you should avoid that, I'm afraid.
I see.
Question 27. You hear a dentist and her assistant talking about a problem with some sterilizing equipment. Now read the question.
Oh, no. It looks like the autoclave is playing up again. The temperature's only 117. That's 4 degrees lower than I set it for.
Yeah, I noticed that. Yesterday it was at 119 and I just couldn't get it to go any higher. Shall I have a look in the instruction manual and see if I can sort it out?
Well, that might invalidate the warranty. Could you find out whether the one next door's working properly? I expect it's because the hard water around here has caused a build-up of scale, and that's affected its efficiency. Perhaps you could ask reception to get the company to come out as soon as possible. If they can't come tomorrow, we'll have to wait until Wednesday and make sure everyone knows it's out of order. If you could send a quick group email, that'd be great. That's the second time this has happened, and it's still under guarantee.
Question 28. You hear a GP talking to a patient with hay fever. Now read the question.
How can I help you today?
I need something to help me manage my hay fever this summer. It's already become unbearable. I don't want to have to stay indoors when all my mates are out enjoying the good weather. We're all off camping next weekend, and I'd hate to miss out on that.
What's bothering you in particular? Perhaps I can give you something to make you more comfortable.
Well, I keep getting this horrible headache thing. It's like at the top of my nose, and it's really getting me down, to be honest. Then there are the watery eyes. I mean, I can feel them puffing up as soon as I leave the house. They're so itchy, red and painful and look awful. I've got a summer job working at music festivals, so there's no escaping. I'm literally in fields all day, every day. Is there something you can give me?
Question 29. You hear two nurses doing a patient handover at the change of shift. Now read the question.
So, in bed 6 we have 83-year-old Mr. Beard.
Okay.
He was admitted this morning and he's been diagnosed with bacterial pneumonia of the right lung. He's quite poorly at the moment, but stable. He's lactose intolerant, so can you talk to the kitchen and organise something suitable for him?
Okay.
Otherwise, he has no known allergies. He's been for a chest x-ray, but we're still waiting for the results to come through. We may need to do a CT scan too, but we'll have to wait to see what the x-ray results reveal before we can arrange that.
Right.
His SATs were at 57, so he's on 2 litres via a nasal cannula, and that's to be reviewed after 2 days, so not until tomorrow morning.
Mm-hmm.
Oh, and I forgot to mention, he had a fever of 39.4, so he's also on antibiotics via IV, which he's not very happy about.
Question 30. You hear a hospital manager briefing newly recruited staff about patient safety. Now read the question.
Within the information team, we provide a set of standard and custom-made reports to suit the needs of staff and patients. Our aim is to provide information into the patient's journey, from their arrival in the emergency department to their discharge from outpatients. One of my responsibilities is to ensure that the information we provide is clear, easy to understand, and straightforward to use, so that we can look at areas of concern, things that are common across departments, and reassure ourselves that we are delivering quality care. When things go wrong, we're able to provide information from the system to enable the staff responsible to review the situation, understand, and learn what needs to be changed to avoid future events.
You hear an interview with a radiation therapist called Roger Atkins, who treats patients with cancer.
We are talking today with radiation therapist Roger Atkins, Programme Director of Radiation Therapy at Hull University. So, Mr. Atkins, why do we need radiation therapists?
Cancer encompasses over 125 diseases. In the UK alone, over 1 million people will be diagnosed with cancer this year. Approximately 70% of cancer patients will receive radiation therapy. The goal of radiation therapy is to eradicate cancer cells, while at the same time sparing normal cells. Because radiation therapy is such an important part of treating cancer, there is a growing need for competent, caring radiation therapists in all parts of the world. As a medical radiation professional, it can be confronting to experience loved ones going through cancer and radiation therapy. But it is also very important the way that we communicate and deliver education to patients throughout their cancer journey.
What inspired you to become a radiation therapist?
My career as a radiation therapist is directly linked to my own mother dying of ovarian cancer during my junior years of college. She was diagnosed with cancer when I was a college student. As I accompanied her during cancer treatments over the next 2 years, I learned about the various people who worked with cancer patients. I remember the radiation therapist who treated my mum. He was a very compassionate man, a good communicator. He was always happy to listen to her concerns and anxieties. Listening to him, the way he worked with my mum, it had a lasting impact on me. Although I was originally a history major, I came to the realisation that my life's work would be working with and caring for cancer patients. From this personal experience, I chose a career in radiation therapy.
What does a radiation therapist do?
A radiation therapist is a valuable member of a cancer treatment team who delivers radiation treatments to patients, helps construct treatment plans, and works with cancer patients and their families. Cognitive psychomotor and effective thinking skills are used every day. When a patient is treated with radiation therapy, they can only receive a limited amount of radiation dose each day. Consequently, it takes anywhere from 2 to 8 weeks for a patient to complete their treatment regime. Because they usually see the one patient 5 days per week for so many weeks, radiation therapists often develop close relationships with their patients. The radiation therapist also needs to be able to plan, evaluate, and assess several parameters for each patient every day. The radiation therapist will also assess the patient's reaction to treatment, providing advice on the side effects of treatment and methods of alleviating these.
Can you describe an individual case to us?
Well, I recently treated a patient called Susan. Now, Susan was quite comfortable in the radiation therapy setting because she herself had previously worked in a radiology practice. She even went as far as to tell me that she felt cared for in that environment. Her husband, however, had a different reaction to Susan's radiation therapy altogether. He found the linear accelerator confronting. He had trouble reconciling radiation dose as a cancer-killing mechanism. After all, doesn't radiation also kill you? And thought the advances of science would mean that Susan would not be treated on an imposing machine in a concrete bunker.
What would you say is the most rewarding aspect of your career?
First, seeing and speaking with patients who I treated 10 to 15 years ago and having them give me a hug is very rewarding. Second, as a radiation therapy teacher, I see the accomplishments of our program's alumni and the many lives they have touched, cared for, and helped cure. We are very proud of each graduate. Their work is noble and greatly benefits humanity. When I teach, I don't only talk about radiation therapy, but I also discuss how the use of radiation can benefit mankind and improve the quality of our lives through both medical imaging and radiation therapy.
And finally, how do you see the future for radiation therapy and cancer treatment?
Well, I think quite a lot about the importance of research focusing on patients' perspectives and improving the way that we communicate and deliver education to patients throughout their cancer journey. It may well be that patients are nervous or anxious when they present to radiation therapy because they have had a difficult experience in another health setting or perhaps have already experienced chemotherapy side effects. Then there's the issue of patients who have a family and young children. Patients in this situation face a quandary in deciding what to tell their children, and each patient manages this experience differently. Many parents want to protect their children from distress and so do not communicate with the children about their illness, or they give them limited information. However, clear and open communication in an age-appropriate way emerges strongly across a number of studies, and quality communication between parents and children is associated with emotional health when a parent has cancer.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear a practice nurse called Bruce Wilkins giving a presentation about a project aimed at delaying the onset of dementia amongst older patients. You now have 90 seconds to read questions 37 to 42.
I'm here today to talk about a new project at our practice which we hope will delay or even prevent the onset of dementia in our patients. Dementia is on track to be the deadliest disease of the century, and globally it poses the greatest health care and social challenges. A recent study revealed that preserving and improving brain health throughout life could reduce the number of cases by up to 35%. And it was this that prompted us to try something different. The research identified 9 potentially modifiable health and lifestyle factors which can increase or reduce risk. We've decided to take this on board and roll out an inexpensive, small-scale and very simple project. The starting point was to get as many patients as possible to go for a test with an audiologist. Listening to the radio, watching television, and picking up meaning in a conversation provide access to a cognitively rich environment. This helps to build something called cognitive reserve, where the brain strengthens its networks and makes it more resilient to deterioration in later life. This explains why the most important risk factor for dementia is having a hearing loss after the age of 45. So, we sent all of our patients over this age a text message giving them information about where they could find a local audiologist. GPs follow this up at their next appointment and discuss the outcome. It turned out that quite a few patients had been struggling with hearing aids, so one of our receptionists was trained to solve technical problems, and she helps them get back on track. The study showed that learning new skills throughout life also builds cognitive reserve. Certain activities have been found to offer particularly effective protection because they form and strengthen brain synapses, and I'm convinced that the most efficient two are learning a foreign language or a musical instrument. So the second thing we did was set up 2 free learning groups for anyone over the age of 45. We asked patients to suggest what they'd most like to learn, and then worked out what we could realistically offer at a minimal cost, and we've ended up with guitar and French lessons. They're very popular and sparked demand for other groups, such as a book club and a model airplane building group. My favourite part of the project is the activity groups run by an ex-GP called George. He's recognised that what's good for the heart is good for the brain. The combined risk factor for dementia of physical inactivity, obesity and hypertension was 9%. George is a very keen walker and organises a group which meets twice a week to walk through the beautiful countryside we are lucky enough to have on our doorstep. The group is very well attended and has revealed many more benefits than we originally anticipated. Not only will it hopefully produce helpful results in terms of physical health, but it's leading to stronger friendships, meaning that those who take part are less susceptible to depression and social isolation, which are also risk factors. That's what I love most about these groups. The benefits are multidimensional. So that's where we are with the project at the moment, but it's forever evolving. We've been contacted by other local practices who are interested in setting up similar schemes and hope that in the future we'll be able to work together in terms of sharing good practice, offering a wider range of groups and building attendance. The next thing on our list is to reduce the number of smokers at our practice. This would lead to huge benefits across the board, so finding an alternative to the usual cessation groups, which are very poorly attended, would be a game changer, not only financially but practically too. Ultimately, I'd like to see ideas like ours being shared more freely at a national level. We could be missing out on opportunities that would make a huge difference. You may be thinking that the outcomes of our project are unlikely to be dramatic, and the findings of the study are unlikely to be replicated exactly, but because we see the far-reaching effects and terrible strain the disease puts on family, carers, and the health service, We believe that even the smallest improvement would significantly benefit our community and potentially our society as a whole. There's nothing to lose, and so far participants have only gained in terms of new skills and friendships. I think the findings revealed in the study tell us it's time we change the way we tackle dementia, or at least try. Otherwise, we risk allowing dementia to shape our society and the course of our lives.